Good morning, everyone, and welcome back to the, I would say, the eighth lecture or ninth lecture on GI system, which is about the small intestine. Yes, you see in the title, guys, the duodenum, but you know that the small intestine is composed from three parts. The duodenum, that we will talk, the first talk will be about it, and jejunum and ileum. So let us start with the first part of the small intestine, which is about the duodenum. يعني الاثني عشر. Well, first of all, guys, you know in general that the small intestine is the longest part of the alimentary tract and GI system, started from the pyloric orifice here, from the pylorus of the stomach until the ileocecal junction. And you know, guys, the small intestine has three parts. The first one, which is the duodenum. The duodenum continues with the jejunum, then the jejunum continues with the ileum until it reaches the ileocecal junction. So we have three parts. So guys, I will start with the most important structure, and the first one, which is the duodenum. Look at it. First of all, the duodenum is a C shape, which is, you know, about 25 centimeters. But yeah, the duodenum itself in Greek language, it means 12. So they estimated that the length of a duodenum is 12 fingers breadth, يعني 12 أصبع, which is, you know, approximately about 25 centimeters. And you see that the duodenum, guys, is the ring that connects the stomach to the jejunum. Right? This is the first thing. And when you look at it, just I'm trying to describe it at the first, it receives an opening from the bile duct and also from the pancreatic duct, which is very important. And also when you look at it, it's like a C shape. Inside this curve there is very important structure, the head of the pancreas. This is the head of pancreas, which is located in the curve of the C shape of the duodenum, which is very important as well. So guys, maybe the last lecture or the previous lecture about the stomach and peritoneum, I don't know if that peritoneum was covered or not, but I'm expecting to know the about the peritoneum. However, guys, the duodenum is a retroperitoneal structure. What does it mean when you say retroperitoneal? That means it's behind the peritoneum. That means it's behind the peritoneum in the back, except the first part of the duodenum. The first part of the duodenum is covered by mesentery, so it's intraperitoneal. The first part of the duodenum, just the first part, is covered by peritoneum because it's connected to the liver, by a peritoneum that thickened to form ligament. So this ligament is known as hepatoduodenal ligament. Hepatoduodenal ligament, which is, you know, part of lesser omentum. I'm expecting that you know the lesser omentum and the greater omentum. Anyway, I will give you brief after a couple of slides about it. So let us locate the duodenum. However, let us draw the shadow of the stomach first. So this is the greater curvature of the stomach, and this is the pyloric part. Again, this is the lesser curvature of the stomach, pyloric part. And you can see, guys, that it begins from the pylorus here. This is the beginning of it on the right side, because if you draw a midline, the median line, right? Midline and the mid of your body. So it starts with the duodenum starts with the connection with the pylorus on the right side, which is about 1 centimeter or 2 centimeters from the midline, and at the level of L1, which is very important. You know, this plane is pyloric plane. pyloric plane at the level of L1. Always remember that for the rest of your life. This is the pylorus of the stomach, and there is a plane here. And I explained how can we determine the pyloric plane yesterday. So this is a pyloric plane at the level of L1, which is between the jugular notch and symphysis pubis, the midpoint in between here, or it's between the zygote process and umbilicus, guys. Now, what I want to say here, guys, that okay, it connects to the pylorus at the right, and because the duodenum is a C shape, then the other part of the duodenum moved to the left, and now it's connected to the jejunum at the duodenojejunal flexure. This flexure or junction is known as duodenojejunal flexure, which is at the level of not L1, at the level of L2, which is about 2 to 3 centimeters from the midline. So we can locate the location of the connection of pylorus to the duodenum here, and the connection of duodenum to the jejunum here. So guys, as you see, and as we mentioned, it's a C-shape and composed from 4 parts. Look at the colors of it. This is the first part, this is the second part, this is the third part, and this is the fourth part. But we can call it like differently by saying, okay, the first part is the superior part, and the third part is the inferior part. Let's just change the color now. Okay, this is superior and inferior. This is descending part, the second part, descending part, and the fourth part is the ascending part. Now the first part, because it's connected to the pylorus, and we know that the pylorus at the level of L1, the first part is at the level of L1. The second part between L1 and L3. L1 to L3. Now, the third part, of course, this is L3, yes, it's at the level of L3 also. But the fourth part, it ascends up from L3 to L2 here. Okay, you have to know all of these things, guys. So let us start, guys, with the most important part. Is the first part and also the second part. But let us start now with the first part. Look at the pylorus here, guys, that connects now to the first part of duodenum. And you see here, the first 2 centimeters of the first part, the first 2 centimeters of the first part is smooth. Look at it. That means there is no mucosal fold. So it's free. And it's the only part that's covered by or has a mesentery that's connected, you know, to the liver, if you remember. And as I said, this is free and is mobile and is internally is smooth, and you can distinguish it in radiology. And what else, guys? So yes, the first 2 centimeters here of the superior part of the duodenum, known as ampulla. It's called ampulla or duodenal cap. You have to know that. So this region that I'm describing, this is the first 2 centimeters of the first part. It's known as the ampulla or duodenal cap. It's up to you. Internally is smooth. There is no mucosal fold. It's the only part connected to the mesentery, and unfortunately, this is the most of duodenal ulcer or ulcers occur here in this part. Why? Because it's very close. The first part that's very close to the gastric secretion. So it's more susceptible for duodenal ulcer. So all of these characteristics, guys, related to the duodenal cap, which is important. Now, somebody can say, yes, what about the rest 3 centimeters of the first part? Yes, the rest 3 centimeters of the first part has no mesentery. That means not connected to other structures, has no peritoneum connected to it, and you know the rest of duodenum here inferiorly. This is okay, the duodenal ampulla and or duodenal cap. So the rest of the duodenum, all of the duodenum is they are located behind the peritoneum, but this part covered by peritoneum, and you see here. Look at the inferior one. Look at the first part, guys. You see this? This is the hepatoduodenal ligament, which is, of course, thickened peritoneum. This is the thickened peritoneum. That's what I'm talking about. Okay. So, what about the relation? You have to know that mostly, guys, in the duodenum, we are focusing on relations. يعني بقول لك شو هذا؟ الديودينم أهم شيء فيه relations. وفيه there are a couple of relations you have to be aware and give it like more focus. Let us start with the first part. First part is important. So again, this is the first part of the duodenum, and of course, guys, anteriorly, look at the liver here above, which is reflected up. يعني رفعناه لفوق, because you know it covers most of the stomach. However, here's, guys, this region of the liver is called quadrate lobe. It's a quadrangular shape. So it's located here, and of course parts from the gallbladder also located here at in the front, anterior to the first part. Now, this is anteriorly. So we have a quadrate lobe and the gallbladder. This is the gallbladder, marara. But most importantly, this is very important. This posterior relation of the first part is very important. Why? Let me show you the posterior relation of it. This is again the first part, guide, of the duodenum. So posterior to it, guys, you will find the lesser sac. You know what's the lesser sac? Look at it here. You see, we mentioned that the first part of the duodenum, the first part is connected or has a mesentery. This is the part of lesser omentum. This is the lesser omentum. Simply, lesser omentum is a peritoneum, double layer of peritoneum that connects the lesser curvature of the stomach and the first part of the duodenum to the other structure, and in this case, to the liver, right? So, guys, what I want to say that behind this omentum, behind the lesser omentum, there is a space. You can get in here by the epiploic foramen. When you go behind it, you will reach to the to a space. This is space. Let me show you if we have it here. No, maybe later in this lecture. So there is a space. The space which is like a sac, known as lesser sac. يعني باختصار هذا شايفينه البريتونيوم اللي بيربط اللسر curvature of stomach and first part للليفر. خلفه لو فتت من الفتحة هاي راح تلاقي فيه عبارة عن فراغ. هذا الفراغ بسميه lesser sac. So behind the first part of the duodenum there is a lesser sac. Just I'm talking about the first inch, just the first part of it, not all of it, because you know it moves laterally away from Russell sac. Just the first part, the first inch of the first part of the duodenum, located behind it there is a lesser sac. Okay, what else, guys? We have very important artery, very important, which is the gastroduodenal artery, which is here, that you see here. So this is artery. What else? We have, guys, also the bile duct that carries the bile secretion from the gallbladder to the second part of the duodenum. So we have bile duct. What we have also, we have, guys, the portal vein. Look at the portal vein here, also located behind the first part. What else also? We have inferior vena cava. So we have two veins, one bile duct, one artery. So all of these structures, guys, located behind the first part. We have lesser sac, gastroduodenal artery, bile duct, portal vein, and so this is a portal vein, not this, portal vein, and inferior vena cava. All of these structures, which is very important. So maybe show you here. Okay, not shown here. That's enough. So these structures behind the first part are important. Superiorly, I think you can see, which is the entrance to the lesser sac. We said behind here, behind the lesser omentum, we have lesser sac. So this is the entrance to the lesser sac. You can insert your finger during surgery. You can insert your finger here through the omental or epiploic foramen, or foramen of Winslow. All of these names used for most common one, epiploic foramen here. So superior to the first part. Inferiorly, guys, to the first part is the head of pancreas. Let me show you, which is here. So this is the first part, and inferior to it we have the head of pancreas. So these structures are very important. So let us move to the second part. This is the second part, the descending part of the duodenum, which moved vertically. Of course, it covers the front of the hilum of right kidney. Let me show you. You see here, this is the kidney, the right kidney, of course. This is the shadow of the right kidney, and this is the right suprarenal gland. Anyway, look at the second part of the duodenum that covers the this part of the kidney, as you see here, covers the front of the hilum of the kidney, because this is the right kidney and this is the hilum of the right kidney. So it covers the anterior half of it on the right side at the level of say L2, L3, but it extends from L1 to L3. So guys, the second part is important, very important also. Most of, you have to expect also a question in the exam about the second part. Why? Because look at the second part and look to the medial border here of the second part. You can see there are like two openings here, or two papillae, one here and one a little bit above it, above it here, right? So I'll use another pen. So we have, guys, an openings for the bile duct. Look at it here. This is the bile duct that descends behind the first part and it reaches here. So this is the bile duct. And also from the pancreas, we have the main pancreatic duct and accessory pancreatic duct, right? So let me show you both. Here is the main pancreatic duct, and this is the accessory pancreatic duct. Look at the main pancreatic duct. It unites with the bile duct here to form like ampulla of water, or called yes, you can say ampulla of water, or hepatopancreatic ampulla. Hepato because it carries the bile that is synthesized in the liver and pancreas from here, so it's called hepatopancreatic ampulla, or ampulla of water, related to this scientist who discovered this ampulla. So this ampulla, hepatopancreatic ampulla, opens into the medial border of the duodenum, the second part of the duodenum. Where is exactly? Mainly in the halfway. So if you say this is the second part, so the halfway is here. So on the medial border, you will see there is a papilla here, which is the major duodenal papilla. So it is the major duodenal papilla through which the ampulla ouverture or hepatopancreatic ampulla opens here to the, to secrete the bile and pancreatic secretion. But also there is another small opening, but not the major one. It's minor, smaller one above it, a little bit above the major one, which is for the secretion of the accessory pancreatic duct, right? Okay, these structures are important. We'll talk more about them when we talk about the pancreas. So guys, again, here's what I described, the bile duct that unites with the main pancreatic duct to form the hepatopancreatic ampulla that opens into the medial border at the midway of the second part of the duodenum and the major duodenal papillae. Also, the accessory pancreatic smaller duct, this one, opens into another duodenal papilla, the minor duodenal papilla, which is just a little bit above the major one. Okay. Now, what's the relation of the second part? Well, guys, anteriorly here, you will find the fundus of gallbladder. This is the fundus of gallbladder, and the right lobe of the liver. I don't know if I have here. So, yes, this is the second part. So also you have the right lobe of the liver and the fundus of the gallbladder located, guys, here. And guys, also you have the transverse colon. You see the transverse colon, it passes here. Okay, all of these structures, in addition to the some calls of small intestine, located anterior to the second part, the descending part, I mean. Now, posteriorly, we have, guys, this is the right kidney. So this is the hilum of right kidney with, of course, right ureter and the psoas major muscle in which the ureter traverse it. Laterally, guys, you have the ascending colon and right colic flexure. You know right colic flexure because this ascending colon, transverse colon. This angle is the right colic flexure, or sometimes they call it hepatic colic flexure. Okay. What we have else other than the ascending colon and right colic flexure? We have also some part of the right lobe of the liver that covers, of course, some part of it. Medially, this is mostly, you will see it in the exam. This is the second part. So medially, there's the head of pancreas. There's bile duct. There's main pancreatic duct. So these structures very important. Located medial to the second part of the duodenum. You see why the duodenum is important? Okay, let us now move a little bit toward the left and see the third part of the duodenum. Look at the highlighted part, which is the horizontal or inferior part, this part, the third part of the duodenum. And guys, it crossed. Let me show you the relation anteriorly of this part. Look at it here. Look at the peritoneum that being carried here. You see the peritoneum that carried here? It's the mesentery. This is the mesentery of a small intestine. So from here, guys, there is a double layer of peritoneum known as the mesentery of a small intestine. From here, they attach to the coils of a small intestine. So the small intestine that's located here attached to the mesentery. And what you saw, guys, here is the root of the mesentery. يعني المكان الجذور اللي بيطلع منه الميزنتري اللي هو الدبل لاير اوف بريتونيوم، الغشاء اللي بيمسك الامعاء الدقيقه السمول انتستين بيطلع من هون. So it passes anterior to the third part of duodenum. So what else, guys? Yes, it has the mesentery passes from here in the front of it, and we know that the mesentery contains blood vessels and nervatic and lymphatic vessels as well. So that means we expect it to have vessels. Yes, we have very important two vessels: superior mesenteric artery, superior mesenteric vein to the right. Those passages through the mesentery to supply the small intestine. So these structures located anterior to the third part, also very important. Posteriorly, look at it here. The third part always is important. Anterior to it we have vessels, and posterior to it we have vessels. Look at the third part. Behind it we have the aorta and inferior vena cava. Look at them here. Behind it. Take care. So, but superior to it, we have the, I would say, part of the head of the pancreas here. Inferiorly, there's like coils of jejunum. So, the last part, which is a really interesting part, curved part, which is the fourth part of the duodenum. This is the fourth part, guys, in which it starts at the level of L3, then ascends to the L2, because this is L2, this is L3. Yes, and there is a like angle here. This is like, it makes like angle here, which is the important. This is the duodenojejunal flexure. Okay, I'm not gonna say too much about that. I have to. Now, from the fourth part, the duodenum, it continues as the jejunum here, right? So this angle, this flexure, this junction is the duodenojejunal flexure. Okay, this angle, guys, as you see, is attached to a kind of a ligament here, which is known as suspensory ligament of duodenum. It suspends the duodenum, fix it to the back. So this suspensory, it's a peritoneum that contains also a muscle fibers. This is called suspensory ligament of duodenum. Clinically, they don't use usually suspensory muscle or suspensory ligament. They use ligament of Treitz. Ligament of Treitz. So this ligament attached to the right, this is the right crus, which is around the esophagus. This is the right crus. So it attached to the right crus of the diaphragm. This is a diaphragm, right? Nothing to say, nothing that much to say about anterior relation, but you see here also anterior to the fourth part is also the root of mesentery. The root of mesentery and cause of jejunum, because jejunum will start here. And superiorly, we have the body of the pancreas, because of the head, and this is the body of pancreas. Interestingly, guys, when you open the duodenum, and I wish we have cadavers, but unfortunately we don't have. Maybe in the coming semesters we will, I don't know if we will get or not, but anyway, you can Google it on YouTube and see the really internal mucous membrane of the duodenum. You remember the cap or the duodenal ampulla, the first part, or the cap, which is like the mucous membrane, which is smooth. Why is it smooth? Because there is no mucosal, there is no folds of mucosal membrane. Indeed, just the small cap part is devoid of folds of mucous membrane. These circular folds, known as plica circularis, it is an important feature of the duodenum, except of the first part, of course, of the first 2 centimeters of the first part, which is known as the cap, or duodenal cap, or duodenal ampulla. We talked about it. So the folds of mucous membrane fold close to each other, form like this mucous membrane known as plica circularis. Look at it here. This is the duodenal cap, the first 2 centimeters of the first part of a duodenum. No mucosal fold. But the second part, because we have here, so this is the first one, which is the A. Now let us move to the second part here. Look at the mucosal folds here, which is very important. Now go to the this is, I think, I'm not sure, but I think this is the major duodenal papilla here, and the third part here, guys, which is again a lot of mucus, mucosal fold or plica circularis. So this is during in the upper endoscopy, right? Here in this cadaver, guys, and I have to finish very close now. This is the duodenum. This is the first, the pyloric sphincter, which is thick. Then this is the cap. This is, of course, the first part of the duodenum. This is the second part. This is the inferior or third part. And this is the fourth part of the duodenum. Look at the second part and head of pancreas here. Look at the second part again and the hilum of the right kidney and the psoas muscle, guys. Look at the ureter. What else? Look at the right lobe of the liver and gallbladder. They are reflected up. رفعناهم لفوق عشان نشوفها. Okay, look to the third part, and behind it, guys, posterior to it, you have the aorta, superior vena cava. Okay. Blood supply of the duodenum. Simply, guys, look at it here. It takes the blood. The duodenum takes its blood supply. I will finish this within 5 minutes. The duodenum, because we have a small intestine, so it comes from the 2 sources, from celiac trunk and from superior mesenteric artery. However, the upper part of the duodenum, guys, gets its blood supply from the gastroduodenal artery. This is the, I will use another pen, right? This is the gastroduodenal artery, which is a branch of common hepatic artery. Common hepatic artery branch from celiac trunk, right? This is the one of the main anterior branches of the aorta, abdominal aorta. Okay, from celiac trunk there is common hepatic artery. From common hepatic artery we have gastroduodenal, from its name, gastroduodenal, that means to supply the stomach and the duodenum. Gastroduodenal artery divides into, it gives, of course, the superior pancreatico-duodenal artery. This is the superior pancreatico-duodenal. From its name, pancreatico-duodenal, that means it will supply the pancreas and the duodenum, because you know the pancreas, it's like it's encircled with the head of it encircled with the duodenum. So we have superior pancreatico-duodenal arteries, one anterior and one is posterior. Now let us inferiorly, the inferior part, guys. You know, if this is the celiac trunk, this is the superior mesenteric artery, which is another branch of abdominal aorta anteriorly. So it gives inferior pancreatico-duodenal artery. Inferiorly, it has inferior pancreatico-duodenal artery. Also, we have posterior and anterior, guys, right? They make anastomosis. Very simple. Veins follow the same. Superior pancreatico-duodenal vein, and we have inferior pancreatico-duodenal vein. The inferior pancreatico-duodenal usually drains into superior mesenteric vein, similar to the artery, but the superior one, it drains into portal vein. Look at it here also from the back, portal vein. There is a lot of variations in this drainage, so you can read from different authorities like different things. Lymphatics, guys, which is always I would say mainly easy to remember the lymphatic drainage, because lymphatic drainage follow the deep arteries. How's that? Okay, we mentioned the blood supply of the duodenum from of course celiac artery and superior mesenteric artery, through of course gastroduodenal artery above and pancreaticoduodenal at the end. Gastroduodenal will give superior mesenteric, if you remember. Let me show you again. Let me remind you with the vessels. We mentioned the superior part by gastroduodenal artery that gives superior pancreaticoduodenal, but here we have inferior pancreaticoduodenal. So the superior pancreaticoduodenal at the end of the day from celiac, the inferior pancreaticoduodenal at the end of the day from the superior mesenteric. So the lymphatics will drain to the celiac lymph node and to the superior mesenteric lymph nodes around superior mesenteric artery and lymph nodes around celiac artery. So they known as celiac lymph node, superior mesenteric lymph nodes. As you see here, guys, this is celiac nodes close to the celiac trunk, and superior mesenteric lymph node close to the superior mesenteric artery. Sympathetic and parasympathetic, of course, from vagus. There is a plexus created around the superior mesenteric. From here, it gives like sympathetic. The superior mesenteric plexus here contains both sympathetic and parasympathetic. So this slide is very important, guys. Take care. And you remember, this is the pyloric orifice, and this is the duodenal cap or ampulla. And remember that an ulcer, usually most of the ulcers occur at the posterior wall of the superior part of the duodenum. So this is the first part of the duodenum. Mostly of the duodenal ulcer, يعني قرحة الاثني عشر تحدث بالجدار الخلفي. In the posterior, most of the duodenal ulcer occurs in the posterior wall of the superior part of the duodenum. Why it's important? So if the duodenal perforated, there is an important artery here, which is the gastroduodenal artery. That means you have to expect massive bleeding, severe hemorrhage here. That's why this part of the slide is important. Let me remind you guys here. I'll show you. Look at the gastroduodenal artery that passes behind the first part of the duodenum. So if there is erosion or ulcer in the posterior wall here, and that will lead to massive bleeding. Let us, guys, continue this هاي سلايدات معيودة. So we mentioned that the small intestine has 3 parts: duodenum, now jejunum and ileum. Well, guys, you will estimate the location of jejunum and ileum. So this is the duodenum, and this is the connection between duodenum and jejunum, which is known as duodenal-jejunal junction. Now, the jejunum usually located at the left upper quadrant. You remember we divide the abdomen into quadrants. So the jejunum usually occupies the most of the left upper quadrant, but the ileum occupied the part of right lower quadrant. So the jejunum, guys, represent, I would say, upper 2/5 of the length, while the ileum approximately about the 3/5. So the upper 2/5 and this is the lower 2/5 of the small intestine. Finally, the ileum opens into the large intestine, and we'll talk more about that. Now, guys, I think the mesentery was covered, but I want to make sure. Look at here, guys. This is transverse section of the abdomen, and this is the lumens of a small intestine. Look at them. They are connected to a fan shape peritoneum, which is known as mesentery of a small intestine. The mesentery of a small intestine connects the small intestine to the posterior abdominal wall, and not just connect them, but also they are a root of vessels. Look, inside them there is vessels, lymphatics, and kind of fat. So again, this is the mesentery. You know, the mesentery of a small intestine is completely one lecture, long lecture, so I have no time to explain it. It's really should be covered in the stomach, but I will show you. This is the mesentery of a small intestine. Let us open this. You see here, this is the intestine, and this is the mesentery of a small intestine. Let us open it. You will find the blood vessels here, in this case, the vessels, arteries, and veins, and lymphatics, and fat. So for a small intestine, I would just remind you that the root of a small intestine comes from, guys, the, say, at the level of L2, left side of lumbar vertebra number 2. Why? Because this is the duodenojejunal flexure at the level of L2. So, and it goes to the right obliquely until it reaches the ileocecal junction. Ileocecal junction, where the ileum connects to the large intestine, or it's easier to say also at the sacroiliac joint. Sacroiliac joint. Here is, guys, also the roots of small intestine. We cut it here. Look at the cut here. And you can see that inside it, guys, you have blood vessels, superior mesenteric artery here, and superior mesenteric artery and vein. And also it crosses the ureter. And also it crosses the testicular artery or ovarian, testicular vessels and or ovarian vessels in female. So for male, you have to say testicular vessels. Female, you have to say ovarian vessels. And I think you remember from the duodenum that the root of mesentery of small intestine traverse the third and fourth part. Again, this is the mesentery of small intestine. Here we remove the small intestine to show you the mesentery that connects the small intestine to the back. We mentioned we have arteries, vein, lymphatics, and autonomic nerves with variable amount of fat inside the mesentery. Here is like we open this double layer or the mesentery that connects the small intestine. Yes. Guys, listen. This couple of slides that talk about the differences between jejunum and ileum, they are very important. You have to know the differences. This table is very important. You have to understand and know the differences between jejunum and ileum, other than the location. You have to know, guys, that the jejunum is like deeper red. That means it's redder because of blood supply than the ileum. Also, the jejunum is thicker, wider, and has a greater blood supply. Or let me show you, guys, in the next slide here. Here is the jejunum again, and this is the ileum. What I meant by a few large lobes. Before that, look at the wall. So you have to say that the jejunum is thicker and the diameter is larger compared to the ileum. And look at the arterial arcades formed here, small, few here, a few numbers of arcades. And because they are few in numbers, guys, they are just one row mainly. So these large arcades is a little bit away from the jejunum. That's why it's connected by vasa recta, long vasa recta. So the jejunum has long vasa recta because it has few arcades. But if you look to the ileum, it has more than one layer, more than one row of arcades. That's why the blood vessels reach the ileum by short vasa recta. So ileum has short vasa recta, but many short lobes of arcades, right? And vascularity is less than the jejunum. So it's important to know that. Here is like para review. You can see the arterial arcades as well and long vasa recta. Here like many smaller arcades, many rows. Because of that, we have just short vasa recta. However, internal structure also, look at the plica circularis. You remember from the duodenum that the mucosa, there is a mucosal fold known as plica circularis. They are like numerously packed in the duodenum and in the jejunum as well. But once reach the ileum, they become to be like fewer in numbers. And at the end of the ileum, they will be replaced and absent and replaced by a lymphoid nodules known as pure patch. So the plica circularis will be disappeared, decreased in number until it disappeared and absent at the end of ileum and replaced now by pure patch, which is a lymphoid tissue present in the mucous membrane of lower ileum. Dear guys, listen, if you know the general idea as I mentioned about the lymphatics. If you know the blood vessels, you can mostly determine the lymphatic drainage. You know that the blood supply of a small intestine mainly by the superior mesenteric artery. So the lymphatic drainage from a small intestine will be to a lymphatic nodes around the superior mesenteric artery, which is known as superior mesenteric lymph node. Okay. Nerve supply, yes, we mentioned that around the superior mesenteric artery, there is also nerve plexus known as superior mesenteric plexus. It contains both sympathetic and parasympathetic. But it's good to know that if you cut the small intestine or if you burn it, you will get no pain. The small intestine is not sensitive to cutting or burning, but they are just sensitive to stretch. Why? Because they are visceral structures. Now, this is the blood supply. Well, guys, I don't know if it's covered in the blood vascular, in the cardiovascular, but let me just show you the branch of superior mesenteric artery. But we'll talk about that later about the blood supply of small intestine. So this is the superior mesenteric artery. So it gives a couple of branches. It gives to the left jejunal branch and ileal branch, because this is jejunum and this is ileum. So these are jejunal and ileal branch, about 15 to 18 branches. And you have ileocolic branch and right colic to the ascending colon. And you have also middle colic artery. And of course the inferior pancreatico-duodenal. But guys, the blood supply of our topic today for jejunum and ileum, it's pretty easy. It's from the superior mesenteric artery, yes, but which branch? Just jejunal and ileal. Those 15 to 18 branch from the left of the superior mesenteric artery. Also guys, shown here, jejunal branch and ileal branch. Sometimes it obstructed. Any one of them is vulnerable for obstruction. We'll talk about that. because I don't know if I have time, but the superior blood drainage of the small intestine carried out by the superior mesenteric vein, because you know there we have superior mesenteric artery and superior mesenteric vein. Of course, the superior mesenteric vein will unite. This is very important. This is very important. But we will talk about that when we talk about the pancreas. But let me just, you have to keep it in your mind because this is very important in the exam. The superior mesenteric vein, it drains the blood, yes, from a small intestine, and it unites with the splenic vein behind where? Behind the neck of the pancreas to form the portal vein. To form the portal vein. So the portal vein formed by superior mesenteric vein and splenic vein united behind the neck of pancreas. So guys, the small, if there is any pain in the small, in the jejunum and ileum, you know that the pain from there will be transmitted through the superior. Do you remember the superior mesenteric plexus? From superior mesenteric plexus to the spinal cord through, of course, splanchnic nerve, carried by splanchnic nerve, now to the 9, 10, and 11. But we know that spinal cord also gives spinal nerves, thoracic nerves, 9, 10, 11. So that means when there is pain in the jejunum and ileum, the pain transmitted to the spinal cord and then translated on your skin by these cutaneous nerves, spinal nerves, right? Spinal nerves, of course, has motor, sensory, and cutaneous. But anyway, cutaneously on the around the area of the umbilicus. You know the umbilicus, the around the T8. So it's at the level, not at the level of thoracic, but I mean the thoracic nerve number 10 innervates it. Let me show you here. So, which is easy to remember. So, say for example, this is the umbilicus. So, you know, we have thoracic nerves 1, 2, 3, 4, 5 until 12. So, number 10, thoracic nerve number 10 at the level of the umbilicus. Here is the 9, and here is the 11, guys. So the pain from an intestine will be translated on this area of your body as a pain known as a referred pain. So any occlusion, guys, in the mesenteric artery will lead to death of all or parts of your segments of the gut. Listen, guys, halfway down the second part of your duodenum to the left colic flexure. Why? Let me show you here. You know, guys, we have here the duodenum, and you know that the duodenum, guys, supplied by celiac and superior mesenteric, and you know that the inferior pancreatico-duodenal artery supplies the inferior part of the duodenum, and the superior mesenteric artery also gives jejunal branch and duodenal branch. If there is obstruction in the superior mesenteric artery or occlusion, that means you have to expect death of from second part of the duodenum that supplied by the mesenteric, because you know the upper part of the duodenum supplied by celiac trunk that gives common hepatic, then gastroduodenal, then from gastroduodenal superior pancreatico-duodenal. So from here and down will be injured, as you know.